Right, today's the day that I have my hip operation. I'm so nervous. Got here for 7:30, checked in, I'm now in my room. I've met my consultant again, I've met the anaesthetist, the nurse has done my ops, and I've just got to get changed in a minute into my very sexy hospital nightie. I'll just quickly show you around the room. So this is the room. I've got a television, got my own bathroom. Just go and have a look in the bathroom. Nice shower. And then we have another sink here. I can have a wash or wash my hands, and my bed. And that's about it. Right now, what I wouldn't give for a cappuccino or a coffee of any sort. I last had something to eat. Oh gosh, it was about 7 o'clock last night. I'm allowed to sip water. My throat is so dry. Just so nervous. But this will be the start of a new me, a new improved me, somebody who can hopefully run again, walk distances, and do the exercises that I want to do. So I'm going to sign off for now, and the next time I do an update I will hopefully have my new hip. Bye bye. Hip's been done. I feel very groggy, in quite a lot of pain, but hopefully this will be the start of my recovery, and I'm just so glad I've got it out of the way. So today is the day after the operation. Last night the pain was probably unimaginable, and I was given quite a lot of morphine. I can't describe the pain. It's just, I was actually in tears at one point, and I thought I had quite a high pain threshold, but they do manage the pain here, and I'm feeling a little bit better this morning, and my physio will be visiting me in a few minutes, not in a few minutes, in a few hours, to get me walking again hopefully, and then I will do another update. Right, it's approximately 24 hours, just a little bit over from when I had my surgery, and I'm not too bad at the moment. My blood tests came back that I am slightly anemic, which is very common after you've had blood loss in the surgery, but nothing to be worried about. My blood pressure's good, kidney function's good, and the only thing, my pain levels go up and down, and you think you're okay, and then it just comes on in waves. I managed to walk across the room with a Zimmer frame earlier, and when I got back to the bed I was absolutely exhausted, which the physio told me that I would be. I only did about probably 4 meters, and felt completely wiped out and had to have a sleep. I'm really hoping that I get a better night's sleep tonight. Last night I was in so much pain, I was crying, and I wasn't being a drama queen. I really was in pain. So I'm really hoping to get a better night's sleep. I've got Strictly on tonight, so that will take my mind off other things. It'll be something that's joyful to watch, happy. I'm just having something to eat now, just a chicken salad and a cappuccino, which is very nice. And then I might have a little snooze and wake up in time for Strictly. and I will do another update later on. Bye bye. So today's October the 10th, and I've just been having some physio, learning how to walk on my crutches. I have to learn how to get up and down the stairs on crutches, which will be interesting. I don't think anything ever prepares you for the amount of pain that you're going to be in after something like this is done. I needed, it was quite a complicated procedure in the end. Wasn't your bog standard normal hip replacement. They had to make my socket a lot bigger because it was very shallow, and then he literally had to wedge the implant in, and it's wedged in with pins, and it's just the pain. I'm still glad I've had it done, because I know that this is going to change my life, but I'm just not in a good place from it now. I'm going home today, or I'm going home to my parents, because I know that they'll look after me really well, and the car ride is quite a lot shorter than it is back to Lincolnshire. With the dogs and everything, I can't risk them jumping up and knocking me over. I'm a little bit worried about pain relief when I get home. They are sending me back with some very strong oxycodone or oxytocin. I did have morphine quite a bit. To be honest, I've had everything, and I'm not sure now what's working and what isn't working. I can't shower for 2 weeks, so I'm going to be lovely to be around. No, I've got wet wipes and things, but it's my hair. My hair's going to be a right mess. Really horrible and greasy, oh God. Anyway, I've got another tutorial with my crutches in a little while. Just going to wait for these painkillers to work. And I will do, if I feel up to it, another update tomorrow. Over and out. Bye bye. So I'm now at my parents' house in Ashley, and I've taken quite a lot of pain medication because it's still quite hard. I've managed to walk up the stairs with crutches, and I've managed to walk down the stairs with crutches. Everything is exhausting, but I'm being thoroughly spoiled. I'm getting lots of attention, it's lovely. And this is probably the first day of my proper recovery. There's a few things that I can't do. Obviously I'm not allowed to bend down, can't bend my knees, can't bend my hips, can't bend my left knee at all. So I'm having to work around that. Sleeping is the hardest because I'm having to sleep kind of sitting up. I can't lay on my side at all. But that's about it. So everything's going as it should be going. My blood test results came back, and they're what they should be. I'm on blood thinners at the moment. They were injected into my stomach while I was in hospital, and that was really painful. But I'm taking oral medication now. So today's been better, but I'm just finding it really hard to actually sit in a chair for any length of time. I managed 10 minutes and I was in agony, but I can sit up in bed, but I need to try and sit in a chair for longer, if I can, because it's good for your lungs. And that's about it. So that's just a very quick update. I will speak soon.